Well, good afternoon and welcome to the 104th session of the Flint Community Webinar on Coronavirus. It is March 11th, 2022. The webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. We are so glad that you joined us today, and many of you have been here with us for most of these 104 weeks. I've been excited to be your moderator for these weeks. Yvonne Lewis, a co-director of the Healthy Flint Research Coordinating Center, and I am just ecstatic about what is going to happen here today in this webinar. So we want to ask you early on, we say this every week for the 104 weeks, we ask you to consider all the wonderful partners that have been a part of this and let you know for the partners how much we appreciate your participation. But for those of you who have joined us as community members, your organization may be represented here, or you may be a community member that has benefited. We want to appreciate you for this 2 years now. Today marks 2 years, March 20th of 2020 to March 11th of 2021. We had a leap year in there, so that gives us that extra year. So we welcome you here today. We want to share with you today some of the highlights that have happened over these last 2 years during this webinar, and we want to honor your commitment. We, the Healthy Flint Research Coordinating Team, came forward with this webinar hoping that it would benefit you and bring a local context to this global pandemic. So today, we want to honor the commitment that you have made, as well as honoring the commitment of all the partners who have put so much time and effort into being here. We're expecting our congressman. He's busy today, but we'll look for, we do have a clip for you today from some comments from Congressman Kildee. We want to start our webinar. It's going to be pretty full today, but we want to start our webinar with a look back, taking a look at what's happened over the last 24 months and how you've participated and what has been said to us about this coronavirus. So let's take a look now at this clip. Well, good afternoon. Good afternoon. Good afternoon. I'm excited to be back with you today. Welcome to the Flint Community Webinar on Coronavirus. We will have wonderful speakers that will give you some insights today. We have addressed a myriad of issues that face our community. As we prepare to get into our conversation today, I wanted to remind you that our goal for this webinar was to provide some local context to the global pandemic. Although we've done lots of wonderful work, we've got lots of work to do, and this webinar provides a great opportunity for us to get all that information in one space at one time.
When in doubt, get tested.
Right now, there is no cure, there is no vaccine, so we have to do the work that helps our bodies be strong.
Our bodies are always going to be our best defense. Stay at home as much as possible and practice distance and smart strategies when out of the house.
I'm just encouraging people, get the vaccine.
All of the data shows that when we look at the people who are getting hospitalized and who are dying from COVID, it is in large part people who have not been vaccinated.
What do we need to know about COVID booster shots? A lot of questions around that.
She encourages all eligible Michiganders to get an additional dose to protect themselves.
We've got to help out our hospitals and our healthcare providers by doing everything we can to keep our kids and ourselves healthy. And that includes vaccinating the kids who are eligible for vaccines.
The good news is cases are down.
Great news, folks. Cases are down in Genesee County.
Nationwide, 14.2% of the cases have involved children.
Over 327,000 people have received at least one dose of the COVID-19 vaccine.
So we did see a decrease in the total case counts this week for all of Genesee County.
Cases are on the rise in Genesee County and Flint, and so are hospitalizations. We are literally updating this stuff hot off the press. The cases are going to be on the rise in Flint and Genesee County during the next several weeks.
We are still seeing our numbers go up.
Genesee County remains at high risk for COVID transmission. More than trivial increase in cases. This really is giving us the opportunity to reflect and see the real disparity and inequity that we have in our healthcare system.
We want to make sure we're taking care of our chronic health conditions. Now is the time not to forget about those.
Always happy to be here with you all and always happy to kick right off into policy.
Earned income tax credit relief.
It's necessary for us to understand that health is more than the absence of disease.
We're still working on building a new normal.
The perspective of the faith community.
Opportunity to celebrate life today, and the opportunity for us to be sure that we're doing those things that will make a positive difference in our community.
We are people of hope. We believe in recovery and wellness and resiliency.
This is not a burden that you bear alone.
And let's do what we can to be well, be healthy during this time.
We want to encourage our social workers and our community health workers.
Continue to apply for those social work credits.
Email us any questions that you might have. Subscribe to the YouTube channel. Like us on Facebook. Thank you for joining us for the Healthy Flint Research Coordinating Center's Flint Community Webinar on Coronavirus.
Join us next week, and we will look forward to our conversation.
So there you have it. It's a real glimpse of what happened over the last 2 years, and we could not have done it without you. All of our partners that are here today, I see you in we call it our Hollywood Squares. This is the introduction to one of the most phenomenal groups of individuals that I know. And so right now, I just want to take a minute, talk to those of you that may have joined us, but may not really realize the Healthy Flint Research Coordinating Center was organized before the pandemic. But it was organized out of our need to provide information to our community, particularly about research. And one of our founding members is here with us today, Rebecca Cunningham. So I want to showcase all of the co-directors, Dr. Deborah Verholden, Dr. Ken Sylvester, Dr. Susan Wolford, who am I missing? Dr. Rebecca Cunningham, I see you somewhere. There she is. There's Rebecca. Now, Rebecca, I want to chat with you first. I want to say Dr. Tanya Turner. Tanya Turner is one of our co-directors. Rebecca Cunningham was with us in the early days in the founding of the Healthy Flint Research Coordinating Center. It's been a number of years now, Dr. Cunningham, and you have transitioned off of our executive committee to some bigger and better things at the university. But I want to get your reflection this morning about your experience with us starting and where we are now.
Hey, good morning, everyone, and so great to see you, Yvonne, and all these faces this morning. I can't say transition on to something bigger and better because this is great, and I'll reflect back on the very early days, which was, of course, before COVID, when we were all deeply concerned about response to the Flint water crisis and how our multi-universities, might come together to better serve the community with community input and voice, and how together we might make the community that folks are living in better, and bring research and real data and voice to that to ensure that we are working in the best possible way together. So seeing that as from where it's come from those early days, from University of Michigan Flint, from our Ann Arbor campus and MSU with community partners, from that public health crisis, which continues in its own way, to transition to this public health crisis, and setting that up helped the group be more ready to address this public health crisis. And look at what you've done. I loved your preview, Yvonne, for all that's been done in the past 2 years to address the COVID public health crisis. And I hope the Healthy Flint Research Coordinating Center, will continue on and grow, because unfortunately there'll be another public health crisis, and we need to be ready together for that as well.
Thank you, Rebecca. One of the things, I could never have done this alone. There's a lot of work that goes on in the background, and I don't do it by myself. So that's why the appreciation goes out. But when I think about it, Rebecca, one of the things we talked to some of our partners about across this nation that knows University of Michigan and Michigan State are rival universities, but to see how these organizations have rallied together with community to do this kind of work. So how has this impacted even the work at the university from your perspective?
Yeah, so there should be, my view has always been there should be no rival in doing good work together. If we're focused on the right things, which are the health of the community voices together, that we should be unified as academics in how we work together to elevate those voices and to do good work. The academics need to always have that in the forefront and keep the academic details in the background while we work together. So I think how it's elevated our work, we're always better for the research that our researchers at the university do to bring good solutions forward is always better informed when we're working closely with community and we're learning together from other academics as well. And so this has just been a great example of how we're stronger when we're all together with those voices, Yvonne. And I learned so much working with you and working with our community core, and also always working with our MSU leaders and Deborah Holden and U of M Flint. I see Ken Sylvester here, and thank you, Susan, as well. So
Rebecca, great segue, because the next voice we want to hear is Dr. Deborah Holden. She was sitting at that table, and we don't have with us today one of the other initial leaders, Dr. Seelig from the university, but Ken Sylvester from the University of Flint, Michigan Flint, but Ken Sylvester is here. But we want to hear Dr. Holden. Can you give us some insights on the real, where we are, and what it took to get here?
Yeah, I never envisioned that when we started this 104 weeks ago, that we would be at it for this long, but I'm eternally grateful. I'm new to the Big Ten, at least I was 6 years ago when I came to MSU. And I think Dr. Cunningham is right on the money. We can keep our rivalries in the arenas and in the stadiums, but when it comes to public health and serving our community, we set all of that to the side. So thank God I didn't know that I was supposed to be at odds with my colleagues, because without the partnership, none of this would have been possible. Without the partnerships at U of M Flint. And I want to really acknowledge something. Dr. Cunningham is the Vice President of Research at the University of Michigan. Dr. Sylvester is the Director of Research at the University of Michigan Flint. These are not people who don't have very, very busy day jobs. These are people who have a lot on their plate, but they roll up their sleeves anyway, and they meet us where we are in community and are and have been and continue to be our partners in the work. So I think it's high time. And I tell the Flint community, do not tolerate the universities not working in partnership any longer. It doesn't work. We have too many problems to swap spit over credit or fight over things. We need to be fighting the good fight on the front lines of public health. And I'm just honored to have had the opportunity and the privilege to do it with these folks.
Thank you, Dr. Deborah. So that segues. We're right here in Flint. You're across the street from Ken Sylvester, literally across the street, universities. Ken, you are not at the original table, but you represent University of Michigan Flint. You came on with Dr. Seelig to help lead this fight. So here you've done some great work that many of our community in Flint still don't know about, but just tell us today where this lies for you. And we're going to talk about some of the great initiatives you've got coming up in a future webinar, but you can give us a sneak peek. How has this worked out for the work that you're doing in Flint at the University of Michigan?
Well, thanks, Yvonne. I think remembering back to when we were planning the annual symposium at the Flint Institute for the Arts back in March of 2020, and not really knowing how serious things would get, we actually thought about planning for a buffet at a symposium, and immediately had to recognize how serious this was. I think everyone has been impressed by the mobilization of knowledge and the social connection that pivoting to this kind of online dissemination of information has provided for the community. And I think it's made a really very real impact on knowledge about health disparities, and particularly in terms of the guidance as it evolved, as we understood how serious it was, as the guidance evolved. This became a really important forum for sharing information about the precautions that people needed to take. And I'd have to say on our campus, it's had a very real impact on the conversations that I have with my colleagues about health equity, about community partnerships. And I really look forward to working with you and the other partners in this, in this center on those partnerships going forward.
Thank you, Ken. Now, we don't have a lot of time to talk to everybody today, but I do want to appreciate the other co-directors. Dr. Susan Wolford, you're going to hear from her shortly. Dr. Heatherlyn Uphold and Dr. Rick Sadler, who are also standing in that position for the Michigan State University, and my colleague and partner, Tanya Turner. She's not able to be here on the call with us today, but she is the co-director of the Community Core. I also want to acknowledge in those initial days in development of the the HFRCC, that the Community-Based Organization Partners Community Ethics Review Board was also at the table providing input for this great work. So we just want to acknowledge everyone that has had that backstage work, and now we're going to bring it forward to the front stage. We ask, as we transition, we ask our congressmen on more than one occasion to come and join us at the webinar and to talk to us about what's happening. Again, as I said, he is in another meeting, unable to be here, but we have a clip that we want to share with you now. Congressman Dan Kildee, United States House of Representatives. He's a chief deputy whip, and many people don't know what that, but he's the man in the House for the Democratic caucus. So talk to us, Congressman Kildee.
My priority, has been getting resources for Flint, whether it's through the Flint water crisis or now dealing with this COVID-19 crisis. What I'm trying to do is make sure that our residents have both the health support that they need, but also the financial support that people need in order to follow the medical guidance that they're being given. And we have to also recognize the disparity. And I think it's really important to note this, and I'm pleased that Michigan, at least Michigan, is taking note of the fact that there's dramatic disparity in terms of the impact of COVID-19. It comes as no surprise to us because a lot of the people on this webinar have been in the front lines of fighting the battle to overcome health disparities that disproportionately impact people of color and people facing other issues. The more marginalized populations are at much greater risk. And because we know of what the history of our own community is, we have a significant population who is at much greater risk. So at least in our case, we are taking note of that. What's been frustrating to me is that some voices suggested that because those disparities are the result of long-standing issues that will take a long time to address. I get that. But that doesn't mean there's nothing we can do about it. That doesn't mean we can't focus and concentrate resources in the moment to try to minimize the negative consequence of COVID-19 on communities that face greater risk. And that's why it's so important to get testing. We need to dramatically increase the amount of testing that's available so that we are armed with the information that we need to protect ourselves.
Thank you so much, Congressman. We appreciate you being able to share that with us today. When we talk about protecting ourselves, there are some things that are put in place to help protect the community. In one of our very first webinars, we had Renee Kennedy, who is the director for the Michigan Public Health Institute, share these words with us.
When there is a public health event, the statutory responsibility lies with our governmental public health entity. That is always a coordinated response with both the community and the private sector. And we're really fortunate in Michigan to have leadership that is informed, that has a number of resources. One of the things that I want the community to understand is that it is important for the community to articulate and advocate for their needs. So they are informing the response that the health department and other public health professionals develop. We don't want to develop and implement something that really is not going to be a good response or a good fit in particular communities. This is not one size fits all. We have some fundamental practices that we're implementing, but we also want to be responsive to the needs of community. And certainly our hope is that our response to this pandemic will strengthen relationships and help us see where resources need to be strengthened so we will be better together post-coronavirus.
Thank you, Dr. Kennedy. And I'd like to invite now Dr. Hackett, who is our health officer, back along with Dr. Verholden, Dr. Reynolds, and Dr. Wolford, because she talked about setting up the infrastructure and why that's so important. Dr. Hackett, you came in right in the throes of all of this. The new health officer. So how does this measure up for you where we were then and where we are now?
Yeah, crazy, right? In retrospect. You had all the community connections. I had not ever seen that before. And I've been at, several different places in my career, and everyone just welcomed me with open arms. And it was incredibly uplifting. And then also the data that was already established from the Flint water crisis, it didn't take too much time to look at who was the hardest hit from the first round wave of COVID and see the overlap of who was hardest hit during the water crisis. So I had the data, with Dr. Verholden's group, and we used that then to really guide a lot of our decisions as to where to put our initial mass vaccine clinics, how we were going to establish it. We at one point had 80,000 people on the wait list for vaccines, which was astonishing, and we had to make some sense of that. So we were looking at who was going to be most affected by infection, like the people at the highest risk of severe disease, and also who was least able to protect themselves, like how much square footage do people have to live safely if someone in their household had COVID. So those were the things that were already established. And what I did come in and do then was come in right at the time that we were getting vaccines. And then I was able to pull those together. And really after that, it was the community's efforts that really directed my work.
Thank you, Dr. Hackett. And when you talk about community efforts and those opportunities to work together, I want to bring Dr. Reynolds now. Dr. Reynolds is serving as the chief advisor, health advisor to the mayor. And Dr. Reynolds, how did all of this play in? And we appreciate it because you came right in as the doctor of the city, as I call you, telling us what we needed to do. Primarily focus on those children, but you got us all together.
Well, I thank you. What I tell people is the lead crisis was just a dress rehearsal for the COVID-19 pandemic, because we learned how to work together. I remember having talked to the mayor during that time, 4 or 5 years ago. And I said, Mayor, at the time he was a state representative, we need to declare an emergency. And he handled it. So when the pandemic started, I just happened to go over to his office and say, Mayor, we can't repeat the mistakes of the past. Yeah. During the hepatitis A epidemic in the state, we were cutting off people's water throughout the country, and especially the state of Michigan, especially Detroit and Flint. And we have to stop this because that's the primary tool. Personal hygiene is the primary tool for fighting disease at that time. And he was open to that message. And I must say, within a week, he declared an emergency. And so the relationships and the networks that we have had all this time, as Dr. Hackett has noted, is what has allowed us to do the best we can under these circumstances. So now I'm a senior citizen, and I look at things both ways. I'm a grandfather. I'm at the high risk group for any complications from COVID. That's why vaccination is so important. That's why masking is still so important. And I also am concerned about my grandchildren. And you've heard me talk about my 93-year-old mother. So we're doing this as a community because we will not survive COVID-19 alone, operating in solo. Right. So, remember that spiritual, walk together, children, and don't you get weary.
Yeah, you're right. So Dr. Reynolds, when you talk again about these partnerships, we have the influence of at a big medical center. Dr. Susan Wolford is a pediatrician at Michigan State, University of Michigan. And she's given us so many medical moments. Now, don't give your medical moment right now, Dr. Wolford, but just why has this been so important, and what has that influence from the medical perspective been for you, for us?
Thank you so much, Yvonne. And that's an okay mistake. MSU, U of M. I trained at.
Because we all together, right?
So I'm a Spartan as much as I'm a Wolverine. Trained at both places. So these past 2 years, as has been stated, when we started this 2 years ago, I had no thought that it would last this long and that we would be doing this for this long. But some of the things that seem really important is the fact that we had the structure from the HFRCC in place to be able to use that here. And so I just think it's such a blessing that we had that background, that foundation to build on. And so we were able to respond in this way. And I also want to just speak to the partnerships, because even with the medical moments, it's all about partnership, because we base it on the questions that we get from the community. And then we speak with other experts at the universities who can inform the discussion. And then we provide it hopefully in a way that's easier to understand and easy to share with others who need that science. I think that quite often we need to have a greater understanding, and that understanding makes a difference. And so it's wonderful that people are seeking that and that we're able to help provide that here. And then it's also sort of a call to wisdom, right? To use that information to help us make decisions about what we do from day to day to keep ourselves safe.
Thank you, Dr. Wolford. And just Dr. Dr. Deborah, I'd like you to expand a little bit on that. You're a resident epidemiologist, and Dr. Hackert talked a little bit about expanding beyond the university. You've done that with the data and how you coordinated this with partners, bringing that equity lens to this conversation. So from your perspective as an epidemiologist, you've been able to just give this to us in the little chunks that we can bite, like a little bird.
Yeah, I think knowledge is power. And I think having good knowledge and good information, which I know this webinar has provided, I think we've all been Dr. Wolford and have learned a lot of things that we missed in high school biology because we didn't have teachers as good as she was. But yeah, I think the partnership with the health department and with the state has been unparalleled. We learned in the Flint water crisis that we have to come together to collectively solve our problems. Nobody can do it alone and nobody should have to. And for people who don't know, Dr. Hackert, to me, walks among the saints. She came at a very difficult time for us and has really kept us going and been a great partner and said, hey, we want to work with our university partners. We want to work with our community partners because we are the team that we are, but we can't do it all, and I really appreciate that. And I appreciate the fact that she is so open and also herself has given so much of her time and talent and treasure to speak with community, whether it be in this webinar or other sessions in other public forums. And so the data, I think, have been really important. And now I'm really excited to say, out of a relationship that Dr. Hackert built for us, we are now doing our own genomic surveillance of emerging strains of COVID and other viruses in this community. The good thing about having a health officer who is so connected across the state is she's been able to build bridges and be a real champion that Genesee County get the resources that we're finding popping up in other parts of the state.
Thank you so much, Dr. Deborah. Now, we talked about partners. Our hospital partners have been phenomenal. I wanted to now take a look back and listen to Dr. Michael Tupper. And many of you may know that Dr. Michael Tupper, even though he's not here in the webinar today, he actually came out to be with us when he was doing testing out at Atwood Stadium. But here are some of the things that he wanted us to know about as it relates to the spectrum and severity of this disease.
We don't know how many individuals are out there with COVID-19 that may be asymptomatic. We're hearing various things reported, but we don't have widespread testing yet. So the true disease burden in the population, we just don't have a great handle on. If there are individuals out there that have COVID-19 that are asymptomatic, that is both good news and bad news. The good news being is that those patients will essentially have no note of any illness and recover fully and hopefully potentially have some degree of immunity to the virus. On the other hand, it's bad news in that it makes it more difficult to control the spread. And so that's why these stay-at-home orders are so important, even if you feel well, to minimize your contact, social distance, wash your hands, don't touch your face, etc., just to minimize the theoretical concern that there may be spread from asymptomatic carriers.
Thank you, Dr. Tupper. Now I want to go to our next little tip from before, but I want our panelists to pay attention to this segue. He gave us some information about things that we needed to do asymptomatic, but here's another really important tip that we were given in one of our webinars.
If you look at this diagram, you'll see there are the personal responsibilities. If you're sick, stay home, maintain physical distance, wearing your mask, doing hand hygiene, and covering your cough when you're out in public. Avoid touching your face. If you go into a crowded situation, limit your time. And then we have the layer that are shared responsibilities. In other words, what we advocate for, what we push for, and what our government and our leadership should do. Number one, fast and sensitive testing and contact tracing. Number two, the building in which we go are well ventilated or we are outdoors. The next layer is government messaging and financial support. The next layer is using quarantine and isolation. The last layer, and perhaps the most durable once we get it, will be the vaccine. Whenever we think about, am I going to get vaccinated or not? Think about, am I also doing the other 9 layers of cheese to make sure that the vaccine is effective in our community?
Well, Dr. Reynolds, I know that kind of got you ready and ready to talk a little bit more. And I want to invite you, Dr. Reynolds, and our team, and I want to include Tarnisa, who's from Hurley, in this conversation because she gave us some good updates this morning. Dr. Reynolds, that was back in early 2020. How is that applicable to what we're seeing right now?
All those things still apply. And first of all, I'd like to thank some colleagues I've never met from Australia who laid this diagram out like that, and I stumbled upon it. And these are basic fundamental tools. And you've heard me say many times before, vaccination is the foundation for the prevention of infection complications. And you see, I've had to change that a little.
I just noticed that.
Yes, no vaccine is 100%. But we do know that most of the people who have been hospitalized since the vaccine, most of the people who have been in ICU since the vaccine, most of the people who have died due to the vaccine are those who have been unvaccinated. And then we've proven over and over again.
Those who died due to the virus, Dr. Reynolds? I think that's what you meant to say.
That's what I'm saying.
Okay.
That is what I'm saying. And then we come to the issue of protecting our children and our elders. When we started all this, we would talk about, well, we don't see infections among children. It's just the disease of the elderly. Then we started noticing, oh, now we have to protect pregnant women. So if you know someone who's planning on having a baby, if you know someone who's pregnant, if they have not been vaccinated, encourage them to get vaccinated. Have them talk to their OBGYN. Take them to get vaccinated because the child is at risk of respiratory complications and the mom is at risk of complications from COVID. So we're learning more and more about the groups that we have to focus on, the immunocompromised, those who have had organ transplants. And let me ask you, do you know people walk around with signs around their neck saying, I'm immunosuppressed, I'm immunocompromised, I'm pregnant, I'm 93 years old? No, folks don't walk around like that. So we have to assume everything we do affects our neighbors, our household, and our community.
Thank you. And Tarnisa, this is an ongoing conversation. You mentioned something about the hospitals this morning. Things are better. However,
yes, our patients that's positive with COVID virus inpatients, the numbers are in low single digits. However, it still is important for everybody to receive the vaccination. Like everybody has said, it is an extra layer of protection. We have been in the community diligently educating and creating a safe space for the community residents to ask questions. I know a concern that some of the community residents were feeling pressured. So we've been doing everything that we can possibly do to create safe spaces for education so that they can ask questions and make the informed decision to get the vaccination. As everyone has said, I can't state it is very important. I have seen many turnarounds and many recoveries.
I think we've kind of lost her a little bit. Dr. Deborah, can I bring you out for a moment? Thank you, Tarnisa. We lost you for a little bit right there at the end. But Dr. Deborah, one of the things that you said as it relates to pregnant women, as Dr. Reynolds was sharing, and we're talking about getting the vaccines, you and I've had this conversation. We're not trying to demonize anyone, but really trying to raise some insights on why there's value. And you gave us a really good example about the vaccine not passing the placenta, particularly because there are a lot of pregnant women or those who are looking to get pregnant have that concern. So can you just give us a little bit of that insight as a reminder?
Yeah, sure. We now know we got plenty of data. We've got lots of pregnant women, thousands and tens of thousands who've received the vaccine. I myself became a new grandma during COVID. Everybody knows baby girl India, who was with me for several months. You saw her on the webinar. My daughter had the same conversation, and I get the hesitancy and the fear that some pregnant women had about getting the vaccine. But what we now know is the vaccine does not cross the placenta. By the time your body uses it and takes the instructions and makes that spike protein and gives you that running immune response, by the time it does that, it then wipes the rest of it away with a cellular cleanup process, and it does not cross the placenta. So if you get the vaccine, you are not giving your baby the vaccine. What you are giving your baby is COVID antibodies. The antibodies that you will create from getting the vaccine, those do cross the placenta. So my sweet India, my sweet grandbaby India was born with COVID antibodies because her mom got the vaccine when she was pregnant, and she got those antibodies the same way she would have gotten them through breast milk. She got them while she was in the womb. The other thing that we've learned is that the virus does cross the placenta. So if you can track COVID and you're a pregnant mom, it is possible that you could also pass it on to your unborn fetus. And so I always ask moms, what would you rather give your baby? COVID antibodies or the COVID virus? I think when you think of it that way, the choice is pretty clear.
Yeah, thank you, Dr. Deb. And we ask you about that because you're the data lady. But I do just one quick thing, Dr. Wolford, in your experience there at the hospital, and we're talking about this, we know that everybody cannot get vaccinated for whatever the reason. And so your medical advice to those who cannot get vaccinated, maybe there's a health condition and you know all of those things. So just give us a quick tip there.
Thank you so much, Yvonne. So for that information, I'm going to hark back to what we just heard Dr. Reynolds say. And that is that there are other layers of protection that can be used, and we should all be using them. So if one unfortunately cannot get the vaccine, then we have to rely on the other layers. So being very careful about physical distancing, wearing the mask when appropriate, washing one's hands, remember at least 20 seconds, and we've shown the videos of exactly how you should wash your hands. Being sure not to be in crowded places with other people who might be carrying the virus. So being sure to use all of those protections, and as we've mentioned many, many times, to be as healthy as one can be. So if you're immunocompromised, still be sure that you're as healthy as you can be. And then hopefully the rest of us will remember that we are our brother's keeper. And so that we will try to keep them as safe as we can by ourselves being vaccinated and not exposing them to the infection.
Thank you so much. And there's a really important question in the queue. I'm just going to raise it so that everyone knows it's there. Is should women continue to breastfeed once they find out they're COVID positive? So that we won't answer right now. Give you time to think about that and come up with the answer, because we've got a special guest. We've got a special guest, somebody that I watch on TV all the time. I aspire. Dawn Jones is here with us. And we want to welcome Dawn Jones to the Flint Community Webinar on Coronavirus. Now, Dawn, you talk to our community every day, and you're talking about these really important issues that our community faces. Just want to give you a moment to share some insights with our community from the perspective of someone who communicates on a regular basis to community about the news. Okay, maybe I lost her. Okay, while we're waiting for Dawn to come back, let's move on. We've got a couple more reels we want. Oh, there she is. Dawn, are you there?
Hello, can you hear me?
I can now, yes, ma'am.
Oh, awesome. Thanks so much for sending me a link so I could connect with this afternoon Zoom session. And I'll just be very brief. You know, it's important that we as journalists get it right. And That is a part of our role to get it right and to make sure that the community has all of the information that they need, so they can do what they need to do to keep themselves and their families healthy. So I just appreciate the fact that those in the medical community, yourself, Dr. Deborah Furholden, and others have trusted me with the information so that I can do my part to get it out to the community and at least help them make informed decisions about what's best for their health and what's best for their family. So I just want to say thank you for inviting me to be just to listen in on this panel this afternoon and just giving me a few minutes to speak from the perspective from a journalist. As a resident in the city of Flint and as a community member, I can't tell you how it did my heart well when I read a couple of weeks ago that the community was able to close some of the disparity gaps when it comes to COVID-19. So that let me know that the messaging was working as it relates to the people in the community who needed to hear it, and that the role we play as journalists is important, and we got it right. So I just really want to thank you all for giving ABC 12 that opportunity to play a role in that.
And Don, we thank you because we know behind the scenes, you're seeking out the information so you do get it. And I know you and Dr. Deborah worked on that data. And this is important, I think, for our community to know that you're intentional about trying to get the information. Because we hear from everywhere. We talked about that. We see a lot of folks on TV that we don't know. But it's important that we know we can trust the voices that we hear because we're working in partnership to make sure we're all doing our best to get it right.
That's right. That's right. And it's important to me as well. So I just want to thank you all and thank you for the work that you're doing, not only with the pandemic, but just around health and public health, especially in communities of color and people who have been underrepresented so many times, and just getting that information to them so that their outcomes can improve. So we really appreciate the work that you're doing as well.
Thank you so much. And thank you for joining us. We've got more to come. So we want to talk about how do we go from here? So there's a clip that we want to play about herd immunity, something that we've talked about. We've got two really important clips we want to show you. Herd immunity. Dr. Deborah is sharing with us what that means.
Herd immunity is not about people getting sick, some people dying, people developing some kind of natural immunity, and then us moving on. Herd immunity is a critical public health concept, and it is about prevention. It is about preventing people from getting sick in the first place. And the vaccine is one of our best tools that we have right now, besides the basic protocols of wearing your mask, washing your hands, and watching your distance to other people to help us keep people protected and prevent people from getting severely ill, and also reduce the likelihood that if they were exposed, they could spread it to somebody else.
We also had a couple of other really important clips. We wanted to show you some excerpts from medical moments and then the match test. So we want to just remind us of these things. We've already talked about these, but they're still relevant for us today. Dr. Wolford and the medical moment.
Body, but more specifically ourselves as factories.
We would look for what's on the inside, and you need much more skill. 10 times more likely to get infected with COVID if you are not vaccinated compared to if you are vaccinated. And our little sprinkles, as you see, this is oxygen and carbon dioxide. It goes through very, very easily.
Will my mask protect me from the coronavirus? I want to show you the match test. You hold a match 6 inches in front of your face. If you can blow that match out with your mask on, chances are the mask is not sufficient to protect others from you or you from others. Let's see if it passes the match test. Standard blue disposable mask passes the match test. Standard handmade mask, fabric, 1 layer, passes the match test. A standard bandana folded over twice, 2 layers, doubled up, passes the match test. Your scarf does not pass the match test. Remember, if you come out without your mask, pulling a single layer scarf up might not get the job done. Be safe, everybody, and remember, mask up.
You know, there's a lot of conversation about that. So before we're over, we're going to talk a little bit about what the current recommendations are, but we want to show you 2 more quick clips from some of our past webinars.
We are very excited to have our scholars return on Monday, February 7th. Now it's time. We have protocols in place. We are also adding KN95 masks. I urge all of our family to ensure that your child keeping those masks on from the time they leave your home until we are done in school. If you want to keep our children in school, it is important that everyone do their part so that we can ensure that our scholars can stay in school and stay safe.
Thank you, Superintendent Jones.
How well children do and how they're impacted is being confined a lot at home is difficult for anyone. And feeling, if there's times that you're feeling socially isolated and not able to interact with people, it impacts how they function in their daily life. So these are some things that we can do to support our children and support each other. It's very important that we talk about how are we feeling, how are things affecting us, and allow children to just talk about that from their experiences and in a factual way. We don't want to create a lot of worry or too many things that make them think that things aren't going to be okay. We need to support them, encourage them, but allow them just to talk about that and pick a good time to do that.
Thank you so much, Katie Baxter from Genesee Health Systems. And we heard from the Superintendent of Schools, Superintendent Kevlin Jones the second. Thank you all. I want to just call all of our panelists back. We're rounding this 2-year commemoration, honoring the commitment. I am just almost at a loss for words when I think about what it's taken for us to really make a difference in this way in the community. The idea was that we would bring a local context to the global pandemic. And when I look around and see the faces of those of you that are here in the webinar, but I see all of those of you, our community members, who have joined us on a weekly basis to make sure that you have information to share with community. From the seniors, Yashika, I see you, so I want you to come forward. From our senior citizens, Dr. Reynolds has mentioned that, to our babies. They're also very, very important. And so I want to ask Dr. Hackert, after we hear from Yashika, to talk to us a little bit about how this has impacted the seniors. And Yashika, something that you did that has encouraged us in the webinar to continue by encouraging your staff who are social workers to participate in the webinar. Yashika.
Thanks for giving me an opportunity to say something, and as well as for being a part of the panel. I've always encouraged my staff to come and listen to what's going on in community, because that's how we get resources. That's how they know how to provide good information and additional service over and beyond what VAAA does. And VAAA does a lot, but over and beyond what VAAA can provide. Dr. Hackert said it well. She put right down smack right in the middle of all of this. And immediately when I contacted Dr. Hackert, and when we got that line going, that COVID hotline for seniors to get information about COVID and masks and all of everything that was going on, when in a world where nobody knew really where to turn for any additional information, partnerships were pivotal. So I do and am very, very grateful for the community that we serve. We did have a lot of services, and we also saw gaps in services and needs that were available. Seniors were socially isolated. They didn't have access to things that they normally had access to, and then they were afraid to get out, and some of them still are. So we did come up with services and additional services to help address those needs. But at the end, I see some of my team, the VAAA team on now. So we work together by sharing your information via social media, in our in-office newsletter, and then we send it out on our e-newsletter that we send out to the community. So thank you for allowing us to be a part of this.
Thank you, Yashika. We appreciate the work that you do. And Dr. Hacker, I saw you were ready to say something and I wanted to bring you back, but I wanted, this is another link to show how these partnerships are so critically important because none of us can do this alone. Dr. Hacker.
So thank you. I was just going to say, it said the host has disabled my video, so I don't know if that's true or not, but either way. And so
we'll bring you back.
Okay.
But go ahead. There you are.
So when Yashika mentioned that, oh my goodness, I will never forget, and Yashika, you know it too. Somehow there was miscommunication going out initially with the plan to try and get to the senior centers right away. And so I pulled over off of Silver Lake Road about 8 o'clock at night and did an hour-long conversation with Yashika and another person with the seniors. And saying, I am so sorry, you didn't know. So there were a lot of like things that we were working very hard on during those early weeks. And I was really glad to see how it worked out though. And we really could not do it without our partnerships. But still, seniors are the ones who need the most protection. And I know the state and federal programs have really worked to try and get booster shots, first vaccines and then booster shots to our seniors in the more congregate learning living centers. And so we are still working on that. We are just setting that up. But that is, when we talk about what kind of things are putting people at risk for death or severe disease, age is still by far the #1 factor. So that is something we really need to keep in the front of our thoughts, is protect our seniors.
Thank you. And we're talking about protecting our seniors and looking at all the vulnerable populations. Clarence Pierce is here with us today, and he's been a regular attendee until he's called off into some of those important meetings because he runs the Hamilton Community Health Center, which is a federally qualified health center. Clarence, you've been here with us. Where were we then and where are we now?
Yes, Yvonne, it's really been great to be part of this group. And just to participate and to think 2 years have gone by. I mean, it's been tremendous getting out the information to our patients and to the community at large, getting the facts, because there's so many, misinformation out there, so much, and to hear it from this group and to get the information right for our patient population has been very much appreciative for me and for our patients. I want to thank you, Yvonne, for all that work that you've done and all of the partners that's participated in this program for these 2 years. And the work is not done yet, Yvonne. We still got to go further. We got to keep going because there's still so much more to do. And I just appreciate being part of this. And I look forward to working with you as we go forward, so that we can continue to protect our patient population and the community here at large. Thank you so much.
Well, thank you, Clarence. And I tell you, again, as I say, it takes all of us. It takes every organization. It takes our community partners. And we just really want to send out today a tremendous thank you. Now, I may be saying that a lot of times. It's been 2 years. So thank you is just, like I said, thank you doesn't seem to be enough, but we couldn't do it without everyone that's participated. We appreciate. Katie, I want to give you a quick second. Genesee Health System, talking about mental health. What has this meant for you as a part of being a part of this initiative?
Sure, I'm happy to talk. It does say my videos and disabled, but that's okay. I thank you so much for having mental health at the table. It's so important. And our physical health has been at the focus because of the pandemic. But the important thing is that we work together on our whole health. So I really appreciate the opportunity to talk about mental health and to make sure we're doing that and working together. This webinar has been tremendous because it really shows what we can do when we support each other and work together to keep each other safe and healthy, and how important that is. So it's been a wonderful experience, and like Clarence says, there's still a lot of work to do, but we are hopeful, and we continue to work together to support each other and help the community stay safe mentally and physically.
Thank you, Katie. And you talked about stay safe and mentally and physically. Healthcare coverage is one of the important things. And Jim Melanowski is with us today. Jim is the CEO of the Genesee Health Plan, talking about why and where people can get healthcare coverage. Why has that been so important through these last 2 years, Jim?
Well, first of all, it's important, as we've talked so many times, that it's good to have a primary care home. So when these situations come up, the pandemic, or should I get vaccinated, all those questions, you should have a trusted physician and medical expert that you can go to. And a lot of times you need healthcare for that. And so it's important for everyone to have healthcare coverage. If somebody doesn't get them to Genesee Health Plan or to one of our partners in the community, everyone should have healthcare coverage in our community.
Thank you, Jim. And I'm leaning in a little bit, because when we talk about everyone should have it, we need people, when we say our boots on the ground, we're the agencies and organizations here to provide resources and do connect. But we've got some wonderful community members, our community health workers from our various organizations. And we have two a part of our panel today. I'm going to ask them to take a quick minute. I see Perlita, Iris, and I see Gwendolyn Richardson. I just need, because this is the agencies are represented here, but our community members are represented as well. Gwendolyn, can you unmute yourself and share with us? There you are. We need you to unmute, Gwen.
It's been a great experience, just enjoying the webinar every week, and there I am, live and in living color. What is that all about? Well, I'll figure it out in a minute. It's been a great opportunity to share all the resources with all of our consumers every week, and it's with this type of partnership and these types of resources that we've been able to make this struggle a little bit easier for some of our consumers in Flint and Genesee County. So we appreciate that and appreciate the opportunity to participate today.
Thank you. Perlita Irish. Unmute and unmute yourself, my dear.
Here I come. Hi there, how are you guys doing today?
Good. Great.
Okay, so I just came in from being out on the road, but no, I just want to thank, because this is wonderful. It's a community, worker out there, it's, they are our community that gets the information from us. So it is important that we stay on top of what's going on so we can relate that information, because we all know, they get the information they depend on the information from all of us, right? So it's community workers, and we are the ones that need to provide that information. So this has been great, staying on top of everything that has been going on, and I'm very grateful, and I appreciate that, this webinar started.
Thank you, Perlita. So voices from the community. I have the response to the question. Dr. Reynolds, this is for everybody. The question about breastfeeding. He says it requires us to have a more detailed discussion using CDC guidelines and having some from neonatal staff. So look forward to that. We are just about out of time today, and I wish we had more time. I want to thank everybody. If we can go back to square one and have everybody say something, we would definitely do that. From the community members, all 91 of you that participated in the webinar today, those of you that have joined us on YouTube or Facebook, thank you. We want to show you some appreciation. We can't give everybody a certificate in hand today. So on the webinar, we want to say, on behalf of the Healthy Flint Research Coordinating Center, we appreciate you, and we proudly honor you today for your commitment to the Flint community in support of the Flint community webinar. We've all dealt with the issues over these last 2 years. And as it has been said, there's more work for us to do. So we'll be looking to you to give us some additional insights and updates on what are the topics going forward and how often we should do that. One of the ways we want to glean this information from you is from a survey that will come up. We do need your feedback. Following the webinar, you will receive a survey in your inbox from Dr. Heatherlyn Uphold, who is behind the scenes working diligently in that team. Thank you. But you'll receive that survey from us. To please fill out that survey and get back with us. We want you to know that we appreciate you for joining today. Those of you who are community health workers and social workers, continue to apply for your continuing education units and your social work credits. Please stay on about 15 seconds or so following when you sign off the webinar so that you can get the information so you can get those credits. We want to again thank you for joining us today for the Flint Community Webinar on Coronavirus. Like us on Facebook, subscribe to our YouTube channel, Healthy Flint, and of course, always you can email us at info@hfrcc.org. And if you're not one of those persons that use the email, call us at 810-835-2130. And by your request and our delight, we'll ask you to join us next week for session 105, because hopefully you will tell us the direction that we should go next. Let me again say thank you to all of you that have joined us for the Healthy Flint Research Coordinating Center Community Webinar on Coronavirus, 2 years and counting. Thank you and enjoy the rest of your weekend.